I'm an x-ray tech. I've been doing this for 10 years. 2009 is whenever I first started hurting, and I just couldn't get out of bed one day. Went to a walk-in clinic, and they just said, oh, I pulled a muscle. I went probably about 2 years like that, just hurting.
Trindi had a prior decompression and has just had some kind of chronic lingering back pain issues from that.
That lasted a good 2-3 years until I progressively started getting worse and worse. We went on a beach trip last year, and I couldn't even sit in the chairs, relax. I couldn't lay down, I couldn't get comfortable. Same thing at work. If I sit in a chair, I couldn't get back up. Trying to help patients, we always bending over, picking up machines, pulling machines.
When you have just a degenerated back, even if it's a young age, it disables you. And that was really our goals for her, was to improve her quality of life and try to get her back to those activities.
I went to see Dr. Tronholm, and we did an MRI and x-rays. When I came back with the results, he was like, we can try all the other things that you've tried a million times, but I don't think they're gonna work.
Anytime you have a lower lumbar pathology, L4, 5, L5 is one, that particular region, I think those are great candidates if you're looking to address the disc in a surgery. I think those particular cases set up very, very well for the ALIF, the anterior lumbar and body fusion. One of the things I really like about the ENZA product is that the dome shape fits almost perfectly into the shape of the disc space. Oftentimes we comment while we're in the operating room how this graft tends to find midline. So perfectly designed that even if your approach may be off a centimeter to the right of midline, your graft, when you insert it, will be placed in midline. Plus, with the larger surface area and getting kind of that better graft in the interbody space, you optimize fusion. So I've seen improved outcomes with this particular procedure compared to, say, more traditional open posterior fusion strategies.
I would say about 2 months after surgery, I was getting around, my pain level was above a 10 before surgery, and now it's down to a 2. Just that in itself is amazing. Now, 6 months post-op, I feel like I could do anything.
Trindi was a kind of more classic success story. The goals of spine surgery, especially fusions, are to improve quality of life. She may not be 0, but her quality of life substantially better because she's living at 1 to 2.
If I would have known what I know now, I would have done this years ago. I think about it every day, trying to put on my socks and shoes and just remembering back, like, I used to not be able to do this. It's a total life change.